Phlebotomy, Chapter 1, Part 3 lecture. Today we're going to move forward, and we've gone over our classifications. We're going to talk about accrediting agencies now. The accrediting agencies, we're going to start by talking about the Joint Commission. The Joint Commission is an independent, non-for-profit. It accredits and certifies healthcare organizations. The Joint Commission assures quality care given by the hospitals. When we think about the Joint Commission, it used to be referred to as JCO. We're going to think about the hospital when you think about the Joint Commission. So that's the easiest way for me to tell you to remember is just when you think Joint Commission, think about the hospital. The College of American Pathologists, these are board-certified pathologists. They provide laboratory accreditation and proficiency testing for hospital labs. So that is their role. And then the Commission on the Laboratory Assessment. This is physician-directed accrediting agency. It's popular with physicians' offices, laboratories, and independent laboratories as well. Now, moving forward, you guys have heard of these terms before, the CLSI, the CLIA. These are very, very important, and I've been told that there are multiple questions on your state certification exams about the CLIA and the CLSI, the Joint Commission, and so on and so forth. So please make sure that you take the time to understand which each of these do. The CLSI is the Clinical and Laboratory Standards Institute. All lab procedures are written in accordance with these standards, and there's guidelines put in place for sample collection, and they are published by the lab, and they should be available where all samples are collected, okay? So just making sure that the procedures, know that you should have a procedures manual, and there should be guidelines available for you. You want to make sure, one thing that's important, the CLSI ensures that the procedures are consistent with the current research and regulation, and we need to make sure that the person collecting the lab should be familiar with these guidelines, and if they're not, they need to confer with the laboratory and let them know and bring themselves up to snuff and know what's going on with that. Legal considerations. There are multiple legal considerations that need to be considered. The blood collector can be held legally responsible if an injury occurs to the patient, okay? And there's different types of injuries that could occur. We could have nerve injury, hemorrhage, accidental arterial puncture, which could lead to the patient bleeding out, or inadequate pressure to the vein causing them to bleed. There's different things that could be harmful to the patient that need to be taken into consideration, because you as the blood collector are responsible for making sure that this injury does not occur. So we need to make sure that we understand the nerves, where the nerves are, where we're supposed to collect from, and knowing what sites are appropriate and what sites are inappropriate. Blood collection events can initiate a litigation. So what we need to make sure is that the patient doesn't faint, okay? A lot of people, when they see blood, they tend to faint. So making sure that before we collect this blood, that this patient is sitting down and in a safe position in case they do faint or pass out. Because if they faint or pass out and you were collecting their blood while they stood up, then guess what? You could be at risk for being sued for that, because they could fall and injure their head or whatever. Making sure that the patient is identified correctly. Because if you draw blood on the wrong patient, you send it to the lab, and then a person's being treated for something that's going on with somebody else, that could cause death, that could cause injury. So, you could be held responsible for that as well. We're going to look at HIPAA, the Health Insurance Portability Act. HIPAA protects it protects the patient's privacy, maintains confidentiality. So we need to make sure that we're not passing around unnecessary medical information to people. So this is set in place to protect the patient's privacy. However, you can give medical information to the pertinent people. If you are a nurse working with the patient, it is okay for you to speak with that patient's doctor about what's going on with them. But it is not okay for you to go speak with that patient's brother unless you have permission, written permission to do so. So, understand the difference in what I'm saying there as far as who you release information to versus who you do not release information to. So your lab results, it's okay for you to give the lab results to the patient's doctor. Lab results are only be given to the healthcare provider's patient. They must be given written consent. So this is within all the paperwork. But just make sure that you know that there must be written consent on file. So you'll have the paperwork signed, and this paperwork says that it's okay for you to release information to the healthcare providers, but that paperwork does not include family. If they want family or someone in particular to know their health condition, it's important that they give you written permission for that. Patient consent, we need to let the patient know what the provider has ordered and what tests they are actually fixing to collect. Make sure that you explain the procedure. And of course, we have to have informed consent. The blood collector is legally liable for not obtaining informed consent. But the patient may give informed consent verbally or by extending their arm up and rolling their sleeve up and extending their arm out. So what I mean by that is this informed consent can be verbal. You walk in, "Hello, Mr. John. How are you doing? I'm here today. The doctor would like for me to check your blood. This is the test that he has ordered. Do you mind if I stick you?" Mr. John says, "No, I don't mind at all." Or Mr. John just rolls up his sleeve and sticks his arm out. That's giving you informed consent, okay? You're getting your consent there. That's okay. Just so long as you're not doing anything against the patient's will. HIPAA primarily affects the blood collectors when reporting results to the healthcare provider. HIPAA requires that written consent by the patient for lab results to be reported to the provider. So please make sure before you start reporting off to the healthcare providers that you have that written consent from the patient. Now, we're going to talk about chain of custody. This was brought up in the last lecture. Chain of custody refers to the documentation of sample handling. Again, this is used with evidence in legal proceedings such as DNA, blood alcohol levels, drug levels, so on and so forth. Any test that you feel like the patient is at risk of getting the results and trying to hide them or skew the results to benefit their good would need to fall under the chain of custody protection. But with chain of custody, this is documentation of the sample handling. It starts with patient identification and it ends with results being reported. Special forms are provided for the sample handling, and these forms include the date, time, and all of the people that are handling the sample. But this wraps everything up for Chapter 1, Lecture 3, and if you have any further questions, please let me know.